We are honored to be joined by the First Lady of the great state of New Jersey, Tammy Murphy. Good to see you, First Lady.
It's great to see you, Steve. God bless you and your family.
Thank you very much. Same to you. Last time, Tammy, we had a great conversation. You took us on a tour of Drumthwacket. I'll get that out. And you taught us so much about that extraordinary home. And I want to thank you for that.
I'm glad you enjoyed that. It's a hidden gem that we hope to share with more people once we get to the other side of this crisis.
Yeah, that's right. Yeah, let's put that in context. COVID-19, we're taping on the 22nd of October. By the way, check out the in-depth interview we did with the governor, Phil Murphy. Check that out. It's compelling. Nurture NJ is an important initiative. What is it? A, and B, how has it been impacted and affected by COVID?
Sure. Okay. Thank you. So Nurture NJ is our statewide awareness campaign that we started in January of 2019, and it is essentially to help address the inequities that exist right now in our healthcare system, particularly as they pertain to maternal and infant mortality and morbidity. I think you know this, Steve, but New Jersey is ranked 47th out of 50th in the United States right now for maternal deaths. And to put that into context, the United States is 55th in the world. And in New Jersey, you know, when we started looking at this crisis in New Jersey, the maternal mortality crisis, that is, we found that the discrepancies between women of color and others are appalling. So if you're a Black woman in the state of New Jersey, you are 7 times more likely than a white woman to suffer or die from maternity-related complications. And if you're a Black child, you are 3 times more likely than a white child to die before your first birthday. So this Nurture NJ is our campaign to not only raise awareness about this issue, but also to find ways to fix that.
So as we put up the graphic for our ongoing series simply called Confronting Racism, an ongoing long-term commitment that we have to cover every aspect, every conceivable way we can examine structural racism, plain out racism. How has the situation you just described been exacerbated because of COVID?
Listen, we were talking about this before COVID.
Absolutely. We had a conversation at Drumthwacket about this last year.
Right. So what I would say to you is that we have all seen across our country, if not around the world, the inequities that exist, the racism that exists, it has been laid to bear. And those who were in need before the COVID pandemic are in even greater need right now. So any resources that people were lacking before this pandemic came along, resources are more limited and people have less money. And so it's all it's done, and perhaps in a good way, is it's finally Pandora's out of the box. Good luck trying to tell anybody that doesn't exist now. And one thing I just want to say on that is, you know, if it is systemic racism and implicit bias. And I think if you know as well as anyone that if you look to the likes of either Serena Williams or Beyonce, both of whom have incredible platforms, both of whom nearly died giving birth, and that is unacceptable. They have access to the best care that any of us can access. So there's no question. There are multiple indicators that, you know, the social determinants of health, all these things are coming in to wage a war on people of color.
And so another spin-off of this, an initiative we're involved in called REIMAGINEchildcare, focuses on, and again, the Murphy administration very committed in this area, and we talked to the governor extensively about this topic, providing affordable and accessible childcare. Again, exacerbated even more so because of COVID. But again, worse, it's an even more serious problem for women who are Black and brown, correct?
That's correct. I mean, it's logical if you think about it. Childcare in its best of scenarios is inaccessible and unaffordable. If you, and for people who don't have money, people who don't have access to transportation, don't have access to their doctors, having a child at home is going to only make that scenario even worse. So there's absolutely no question. I know that the administration has been working on this, and I give Phil and DHS a lot of credit for the incredibly innovative ideas that they have been coming up with to try and fix this, and they will continue to do so. I also will tell you that it's something we're looking at through the New Jersey Pandemic Relief Fund as well.
Yeah.
So there's a lot of good people working on this right now.
Yeah, I'm so glad you mentioned that because the New Jersey Pandemic Relief Fund, when you first announced it, there was so much media attention. We interviewed you about that as well. Where is it right now? And who is being most affected by it in a positive way, let's say?
So over the past 7 months, we've raised $38+ million. We have deployed probably 25 to 28 million at this time, but we have allocated some more, so we know where we're going. We are really lucky. We've had nearly 61,000 donors at this point, and those donors range from private individuals giving $1 to people giving multi-million-dollar gifts, and they represent every county in New Jersey, every state in the United States, and 14 international countries.
By the way, let's make sure as we finish this part of the conversation with the First Lady, put up the New Jersey Pandemic Relief Fund website if we could, Lauren, if you could do that. Let me ask you this. Someone right now, and again, we don't bill ourselves as a fundraising organization for other nonprofits, but the cause is the cause.
Yeah.
Tell everyone where those dollars go if they want to be helpful.
Sure. First of all, the most important thing to know, all of our expenses are underwritten. Every single dollar we raise goes directly out the door. There's no loss there. So that's one thing. We have looked at we are working right now in the area of the digital divide, helping to close that gap. We've fixed it in Trenton, which is fantastic. There's a lot of places that we are working. I think 8 different cities across the state right now. We did a lot of work in food security. We are doing work in terms of minority and women-owned businesses, trying to help with microfinancing loans and things like that. We're looking at childcare. We want to help find an innovative way to, bridge the gap in childcare. Because when we started out with the fund and we worked on food security and all these other things, we were really being responsive and trying to fill holes. We now realize this pandemic is going to be with us a lot longer than we were hoping. And so what we're trying to do now is find innovative ways to address issues and take it to the next level, as opposed to just doing same old, same old.
Well said. The First Lady of the great state of New Jersey, the Garden State, Tammy Murphy, I want to thank you for joining us. I say this all the time, but it couldn't be more true than it is right now. You honor us by joining us. Thank you so much.
Thank you, Steve. Really an honor.
I'm Steve Adubato. Thank you so much for watching. We will see you next time.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by the TURRELL Fund, supporting Reimagine Childcare, PNC, Grow Up Great, the Healthcare Foundation of New Jersey, the Robert Wood Johnson Foundation, New Jersey Board of Public Utilities, Clean Energy Program, PSE&G, the New Jersey Economic Development Authority, NJM Insurance Group, and by University Hospital. Promotional support provided by CIANJ and Commerce Magazine, and by Jaffe Communications.
I'm Tim Sullivan, CEO of the New Jersey Economic Development Authority. Since joining the NJEDA, I've been struck by the incredible assets and resources that New Jersey has to offer. The NJEDA is working every day to grow New Jersey's economy in a way that maximizes the values of those assets to benefit every single New Jersey resident. This includes more support for small businesses and a focus on reclaiming New Jersey's position as a leader in the innovation economy. Visit njeda.com to learn more about how NJEDA is building a stronger and fairer New Jersey economy.